Hi, we had Saginaw County. So, geographic information, according to the U.S. Census Bureau, as of 2011, the population per square mile was 250.2 in the land area. In square miles, it was 811, and then Saginaw County is the 10th most populated county in Michigan.
So looking at different parks and recreational features across the county, we have a lot, as you guys can see here. So you guys can read the slides, lots of places to go biking, walking, everything. And then Hoyt Park, you can go ice skating or play hockey in the winter, and then the farmers market downtown.
For the age and sex, the most populated people we have are females with 51%. And then for our people, 18 to 65 is our most common ages, whereas everyone else is much less, as you can see on the slide. And then for our diversity, we have about 12,000 veterans in the area, and then about 2.5% of our population is foreign born. And then we also have a chart that kind of breaks it down a little bit more onto the different types of people we have living in the area.
So for socioeconomic distribution in Saginaw County, from 2013 to 2017 was $45,034. As you can see, the city is almost half that. And then for per capita in the county was 25. And then impoverished area 17% was the county, and the city of Saginaw was almost doubled that in those years.
For ethnicity, these percentages are based on Saginaw County. The total population was 934 people, primarily 76.4% white and 19.3% African American. The rest vary, but they're very small percentages.
So looking at religion here, we have a chart for Saginaw County. Majority of the county is unclaimed, and then you guys can see here the breakdown of the other religions, how they match up here.
All right, so in the Saginaw County, we have several community resources. I'll just mention a few. We have the Eastside Soup Kitchen, we have the City Rescue Mission of Saginaw, we have the Saginaw County Public Transportation, the Underground Railroad, we have the Can Council, the Saginaw County Community Action Center, and many others.
So here are our key concepts.
Health surveillance. Saginaw County was ranked number 74 in health outcomes in Michigan out of 83 counties. Not so good. Health surveillance plays a role in health promotion. Some of the things at the Saginaw County Health Department include the Immunization Clinic, Family and Planning, Women, Infant, and Child Services, or WIC, Nurse-Family Partnership, and Communicable Disease. In 2018, the immunization rate in Saginaw County was 26.6 for 18 years and older, and according to reportable disease trends in 2017, STD subtotals were 1,753, and influenza was 9,171.
So there are a lot of vulnerable populations throughout Saginaw County, and then anyone can be vulnerable at any time depending on what they have going on. So you guys can see the list that we have there. And then I just have a couple breakdowns of what makes them vulnerable. So like human trafficking victims, they're vulnerable to emotional, physical abuse, trauma, which can lead to depression, PTSD, other mental health complications. And then homeless individuals are vulnerable to poor nutrition, lack of shelter, transportation, healthcare, and they're at an increased risk of STDs, STIs, TB, HIV, and AIDS, and hepatitis. And then school age and adolescents, they're vulnerable to like bullying, motor vehicle accidents, and then they have risk-taking behaviors like binge drinking that they're vulnerable to. And then you guys can see there's 4 different types of vulnerability there: social, physical, economic, and environmental. And then I've got a list of some of the resources there that can help vulnerable individuals. A big one I want to hit on real fast here is the Eastside Soup Kitchen. So there's a huge food desert on the east side of Saginaw County. There's a major lack of grocery stores. So this is a place where people are able to go and get a nutritious meal every day to help them out, because a lot of all they have over there to offer are like party stores. So they're not offering nutritious foods.
So there are many ways that accountability is portrayed in Saginaw County, and one of these ways is through their public policy. Their community policy often stems from state and national policy, which can structure many of the important frameworks in your community, i.e. reportable diseases. Another way that this is preventable measures like screening for diseases like STIs, immunizations, and law enforcement, and also availability of resources, because it's one thing to have resources available, but also making them readily accessible to members in the community through flyers and so on.
All right, so for human reproduction in Saginaw County, as we've already mentioned, the population is around 191,000. However, the interesting thing is that the population decline is 26%, and the highest population of married couples is older than 65 years of age. So reproduction has actually declined. Some of the reproductive health resources we have to support human reproduction are like Michigan Department of Human Services. They provide Medicaid, SNAP, cash assistance. There's also Saginaw Community Public Health, provide services for public family planning, weekend nutrition, immunizations for STIs also. And we also have, for treatments of several STIs. Now, some of the impediments of human reproduction are like, for example, the Saginaw River, the Tittabawassee River has dioxin. We have PCBs, mercury, which results in low birth weight, preterm delivery, and miscarriages and stillbirths. And also the unemployment rate of 15.4%, and also contributes to that. All right.
So for the culture of Saginaw County, we have quite a few different things that we talked about. So the geographic area, the age and sex, socioeconomic status, ethnicity, religion, and diversity all play a really important role in this. The urban areas of Saginaw County are more, you'll find the restaurants, stores, fast food, doctor's office, hospitals, things like that. In those rural areas, you're going to have more farmland, you're going to have less food places. The roads are going to be more torn down. There's going to be a lot of lack of resources. So those other resources we talked about are really important. About 17.9% of the population is living in poverty with an average of $45,000 per year. There's over 190,000 people living in the area. The majority of them speak English, with about 5,000 speaking Spanish, German, Arabic, and Greek. About 6% of the population has no insurance or very minimal insurance. And then because there's such a wide range of people that live in the area, we have a lot of different festivals and different art places that we can go to look at.
So health promotion is the process of enabling people to increase control over and to improve their health. The best places that we have in Saginaw County is the health department, as well as some others that are listed below. The reasons why we have these places inside of Saginaw are to help with increasing immunizations, to help with children and babies as well as mothers, and help give education. And that's really what health promotion is in Saginaw. And these places are the best places to go, and they can also help with financial aid and other resources. Now, growth and development, the biggest thing that Saginaw is doing is working through the Saginaw County Land Bank. And what they're doing is they're working on increasing the cleanliness of the area, as well as increasing the amount of population that want to come into the area. And that's by destroying houses that are vacant and that are places where drugs and homelessness can increase. So by getting rid of these places and working together to create a better public experience and to have more job skills by getting the youth to help, they're able to grow and develop Saginaw into a better and healthier place.
So looking at the educational breakdown of Saginaw County, at the top here we have the statistic for how many have obtained a high school degree. So it's pretty high. And then below that is the percent of people who have obtained a bachelor degree. So it's a little low at 21.1%. A lot of different charter schools, public schools across the county here. There's a couple of gifted, talented schools. We actually have the opportunity to be at Hemeter this semester. And then there's also schools for religion, like Novell Catholic Central. They have the elementary school and then their high school, middle schools combined. And then for higher education, Delta College, Davenport University, and then of course Saginaw Valley State University.
Okay, then on to violence. Listed are just some of the statistics from 2016 of various violent acts. As you can see, each act was per 100,000 people in the county. Risk factors, some of the common risk factors for violence include substance abuse, poverty, and then mental health disorders. And then just some prevention strategies for violence. The treatment facility, the Wolverine Secure Treatment Center for troubled individuals. And then police that we have, Saginaw County, the state of Michigan. And then the Saginaw Valley State Police, obviously, since the campus is within the county, but their jurisdiction is only within the grounds of SVSU. And then Underground Railroad, they do just more than shelter women that have been had violence against them, such as legal and court support. And then Mid-Michigan Task Force for
So disasters in Saginaw County can be divided into natural disasters and man-made disasters. Natural disasters include tornadoes, ice storms, blizzards, and floods, and then man-made disasters include shootings, house fires, or infectious disease outbreaks. These can cause community complications like car crashes, loss of houses, displacement, or other physical health problems or mental health problems. And then listed below, we have resources that can help specifically to disasters.
All right, our first diagnosis is risk for impaired nourishment among the east side of Saginaw County related to the low amounts of nutritional food available to the population, lack of grocery stores on the east side of Saginaw, and an abundance of unhealthy fish in the rivers throughout Saginaw's rivers that are being consumed. Interventions for this incorporate government taxes to help fund the building of grocery stores in the eastern section of Saginaw County, work with the east side Saginaw County to plan and incorporate a local farmers market to sell fresh foods to the residents of that area. East Side Soup Kitchen set up more bus stop locations throughout the community through government and private funding to enable more individuals to be able to get to and back from stores and markets, and also inform the community on safe fish eating consumption by handing out the Eating Safe Fish guidelines to the public in grocery store markets.
So our second diagnosis is risk for violence among Saginaw County related to high rates of murders, poverty, as well as assaults and auto thefts. And what they're wanting to do with interventions is community neighborhood watch programs, Wolverine treatment centers, and among others that are listed below.
All right, diagnosis number 3 is risk for altered health maintenance among Saginaw County area related to lack of understanding of individuals' own health conditions, large amount of both county and city living in poverty, steady and increasing rates of obesity, diabetes, heart disease, and cancer, and high mortality rates. Interventions include health surveillance, which is secondary prevention, monitoring and screening. Primary prevention, just educating the community on healthy lifestyles, getting vaccinations, resources, and then tertiary prevention, educating people who have been diagnosed of how to take care of their own health.
Thank you. That's the end.